Yes, ma'am.
All right, both ready? So if you've
Yes,
read
ma'am.
and understood, considering it history taking station, please begin.
Hello,
Hi, doctor.
I'm Dr. Naveed, one of the surgical candidate here. Can I please confirm your name and age?
My name is Janice and I'm 67 years old.
Janison, right?
Janice.
Janice. All right, Janice. I have been asked to ask you a few questions today. Would that be okay for you?
Yeah, sure, go ahead.
I came to know that you have had an episode of seizures. Is it right?
I don't know what's it called. I just
Taking.
suddenly fell off and I did not know what happened to me.
Yeah.
My sister told me that I was shaking and I also wet my pants after I checked.
All right, Janice. I would like to ask you a few questions if you don't mind.
Yeah, sure.
So, when did it happen?
It happened 2 days back, doctor.
You told me that your sister noticed it. Uh, what things did she tell you?
He told me that all of my body was shaking and I went unconscious for 5 minutes. And when I got my consciousness, I checked that my pants were wet.
All right. So, did you notice any strange feeling uh, before becoming unconscious, like any chest pain, feeling anxious or fearful?
Doctor, I felt lightheadedness. Yes, I felt dizzy before it happened.
Right. By any chance, uh, did you hit your head?
No, doctor, I did not hit my head.
Did you trip over anything, or did you sleep?
Sorry, can you please repeat?
Did you trip over anything?
No, no, no. I did not trip over anything, and I did not hit my head.
Did you bite your tongue?
No, I did not.
As you told me that you became unconscious. And when did you get your consciousness back?
I was like, my sister told me I was unconscious for more 5 to 10 minutes, and she told me that my eyes got deviated to one side, and I was shaking so severe. All my body was shaking, and I was having some frothing in my mouth as well.
Did she also notice that your eyes were blinking?
No, she did not say so.
Any smacking of lips?
No,
Did you notice any weakness in your arms or legs?
no, I did not have any
And
weakness after I got this.
any problem with your vision?
No, doctor, I can see quite well.
Any deviation of your mouth?
Yeah, she just said that my eyes and mouth was deviated for a time when I was having these shaky movements of whole of my body.
All right, Janice. A few more questions. Please try to bear with me. So, Janice, did you have such seizures before?
No, doctor, it happened for the first time.
Right. Did you notice that any event like having a bad sleep or taking alcohol or fever or any other condition exaggerate your condition and you have fits?
No, not that anything that I'm aware of.
For the sake of your health, I would like to ask you a few more questions. Please don't mind it. By any chance, have you had any history of any problem with your brain?
What do you mean, doctor? I did not understand.
Any unhealthy condition that you suffered in the past related to your brain?
No.
Any trauma to your head previously?
Yeah, I had a trauma. I mean, I had an accident when I was at the backseat of my car 6 months back.
All right. Do you take any medication?
No, I don't take any.
Do you have any previous medical history?
Yeah, I have diabetes and hypertension, so I take like antihypertensive drug.
Is it well controlled?
Yeah.
Okay,
Do you
can you
have
please summarize your history now? Thank you.
Today I took clinical history from Mr. Janis, a 67 years old, who has been admitted in the emergency department with an episode of fits. He has had fits 2 days ago. The
Okay.
fits it included shaking of body shaking,
Yes.
and it lasted for 5 to 10 minutes. He became unconscious. His pants were wet, and he also felt light-headed.
Yes.
In addition to that, he has also had frothing in his mouth. His eyes were deviated. His eyes and along with mouth were deviated. Previously, he has history of trauma 6 months ago. He
Okay.
has comorbid conditions, having diabetes and hypertension, which are well controlled on taking medications.
Yes. So, what
He
is your
has
provisional diagnosis for this patient?
My provisional diagnosis is uh, seizures, benign seizures, and my differential diagnoses are epilepsy,
And
meningitis, encephalitis.
okay, how do you intend to plan this, manage this patient?
I would like to run a few blood investigations like full blood count, U&Es, liver and kidney function tests, and serum electrolytes, blood culture, urine complete examination. In addition to this, a few radiological investigations like doing like a CT scan of brain to rule out any ischemic or hemorrhagic stroke.
Okay.
I would,
What
I would
treatment would you give to this lady?
uh, in case of active seizures, I would like to make a recovery position, left lateral position for the patient, and will perform ABCD approach.
Very good. Yes.
And once the seizures will last, I would like to monitor his vitals. And to stop further seizures, I will give benzodiazepine. And to control the seizures, I will give this patient anticonvulsant drugs.
For
If he
example, phenytoin. Yes.
phenytoin, for example, phenytoin, sodium valproic acid, and phenobarbital. If the patient is in status epilepticus, I will control the seizures. I will take care, first of all, I will take care the patient according to the ABCD protocol and give him oxygen and control the seizures with anticonvulsant drugs and and would like to call in a statist to incubate. If if in case the seizures are gone, I would
Seizures are gone.
if the seizures are controlled,
Okay. All right.
if the
Yes. Then
then I will give benzodiazepines and anticonvulsant drugs, and
Yes.
let the patient run investigation.
Okay. Thank you.
Thank you so much.
What